My name is Russ Pate, and I'm thrilled to be speaking with you today about physical activity and its role in public health. I'm a professor in the Department of Exercise Science in the Arnold School of Public Health at the University of South Carolina, and we have a group here that has been interested for a long time in ways in which we can enhance public health by promoting physical activity at the population level. I have a research group here that focuses on applications of public health research methods in the study of physical activity in children and adolescents. I'm also involved in a number of national projects, including the development of the National Physical Activity Plan, which is a very comprehensive strategic plan for promoting physical activity in the U.S. population. I'm thrilled to be speaking with you about this topic and look forward to sharing with you some of my thoughts about how we can have a healthier population in the United States by promoting more physical activity and enhancing fitness in our population. One thing we've learned about physical activity behavior is that it's influenced by our environment. It's influenced by our social environment, meaning our physical activity behavior is influenced by the physical activity behavior of the people around us, our families, our friends, the people we work with. We've also learned that our physical activity behavior is influenced by our physical environment, and we know that people are more likely to be physically active if they are able to use muscle-powered transportation, walking, cycling, for example, to transport themselves to places where they need to get, and if they have attractive and safe places where they can be physically active for recreation. So I'm going to show you some examples of elements of the physical environment that we know support physical activity, and when people have access to these, they tend to be more physically active. And I'm going to show you some examples of settings that are not so supportive and that tend to be barriers to physical activity. So I'm positioned right now in a very supportive setting for physical activity. This is Pendleton Street, which is the line of demarcation on one side of the University of South Carolina campus. We have a nice, smooth, well-paved sidewalk, and it goes somewhere. It connects between one end of campus to the other. So if you were a student at the University of South Carolina, you lived in a dormitory or in off-campus housing on this side of campus, I think you would be very comfortable finding your way to this sidewalk and walking your way to your destination on campus. So our society, our communities need more settings like this one, where people can safely and enjoyably get from one place to another. I'm on the south end of the University of South Carolina campus on Assembly Street, and behind me is the university's fitness center, the Strom, beautiful physical activity facility. To my right are beautiful intramural fields, nice green space, and areas where lots and lots of students are physically active on a regular basis. And of course you see right behind me that I'm on a beautiful sidewalk that's landscaped, and it's a beautiful and a safe place for physical activity. Thousands and thousands of students are in a position to walk down this sidewalk toward their living facilities. However, we'll take another look at this location in just a moment. We're in exactly the same location, and behind me you see an environment that is not supportive of active transport or physical activity. We have, ending at this spot, a beautiful sidewalk, a safe area for people to be physically active, and we hit essentially a dead end. And as students would be traveling from the central part of the USC campus to where thousands of them live in apartment complexes south of here. This is what they see. They see a beautiful sidewalk end, and instead they see a railroad track. They see the side of a road. They see a very heavily traveled street. And we know from many research studies done on this topic that all of that becomes a barrier to active transport and physical activity. This is an example of what we have to change in our communities. So we're on the Congaree Trail, which is an absolutely beautiful place to walk or ride your bike. We're on the west side of the Congaree River, right at the confluence of the Broad and Saluda rivers. Columbia is just across the river, and we're on the west side in West Columbia and Casey. This is a planned facility. It is an absolutely beautiful walking, hiking, cycling trail that runs for several miles on the west side of the river. It was planned over a period of several decades and has come to fruition over the last decade or so. There's a long-term plan that will ultimately connect to a similar trail on the east side of the river. And Congaree Trail is an example of how communities can plan to develop infrastructure, a built environment that is intended to support a physically active lifestyle. And it's certainly true that thousands of people every week come to this trail to walk or hike or ride their bikes and gain healthful physical activity. Now, there is a limitation though, and that limitation is that it's not easy to get to this trail today in a physically active manner. When we came here today, we got in the car and we drove to a parking lot that's proximal to this trail. And I believe most people who use this trail use motorized transportation to get to this location. In the long term, what we hope is that connectors will be designed that will support reaching this location, ultimately trails on both sides of the river, and it will be possible to reach these locations by riding bike or walking in a safe and attractive setting. So this is a beautiful place to be physically active, and the hope is that in the long term we'll continue to develop this location so that thousands and thousands and thousands of residents of this part of South Carolina will make use of this beautiful setting.